Hi guys, welcome. My name is Leah, and I'm a nursing student, and I'm just gonna go over nursing content because I'm going into my third year of nursing school. So I'm just gonna go over content and explain it as easy as possible so that you guys can understand. Okay. So we're gonna be focusing on coronary artery disease today, and I'm just gonna go into basics. I'll make multiple videos to follow up. You can just let me know in the comments what videos you want me to make, or if you don't understand something, I can explain it. Okay, so we're gonna start with coronary artery disease. We're gonna start with the definition. So, coronary artery disease, by definition, is just the narrowing of coronary arteries due to atherosclerotic plaque reducing blood flow. So when you think coronary artery disease, just think coronary, the heart. So it's just the arteries in the heart, basically. So the definition is pretty self-explanatory, but I'm just going to show you a diagram so that you can have like a mental image. As you can see, I already started working on this diagram, but I'll just clear this up. Okay, yeah. So when you think coronary, or as I said earlier, you think heart, and yeah, so it's just the arteries in the heart. So as we can see right here, so this is the normal artery. And what we can observe is that this is the blood flow. So the blood flow, there's a large amount in comparison to an artery that was narrowed. The blood flow is less. Why? Because that's less pace for blood to come through, as we can see here. So like the definition says, it's due to the atherosclerotic plaque. So it's due to the plaque, right? So this is the plaque right here. So we notice that the plaque is what caused the artery to narrow a bit. So we see that narrowing right here, and that is what caused the reduced blood flow by definition, right? So that's just a mental image of the definition so you can remember. But we're going to focus on the plaque from this picture because it's very, very, very important in coronary artery disease. So this is the plaque. So the plaque is made up of lipids. And the main type of lipid that is made up of is cholesterol. And that's very important, guys. Where does cholesterol come from? Let me use gray. So cholesterol food, the food that we eat, or it's in the blood, like from the food we eat. So the main source is from the food we eat. I'm just gonna say that for now. And so you ever hear people say they don't want to eat anything that's high in cholesterol? That's basically the concept. Cholesterol comes from the food we eat. But the main reason why we need to focus on this is because the carriers of cholesterol, so when you eat the food and it's digested, and I'm putting it in my own words. So when you eat the food and it's digested and the cholesterol is in the body, let's say, two carriers are at play here. So we're going to call them the delivery drivers of cholesterol. So you have LDL. We're going to call him lazy dangerous loopy, LDL. And you have the helpful delivery loopy. So you have two carriers of cholesterol, the lazy dangerous loopy, and the helpful delivery loopy. And you can see right here, this is their real name. High density lipoprotein and low density lipoprotein. But for the purpose of this video, we're going to call them lazy dangerous loopy and helpful dangerous loopy. So what did we go over so far? So we went over the definition, that is the narrowing of the arteries due to the plaque. We already established how the plaque caused the narrowing, and we established effect, which is the reduced blood flow. And then we're narrowing on the plaque. We said that it's made up of lipids, and one type of lipid is cholesterol, which comes from the food we eat. Cholesterol is delivered by two drivers, LDL, lazy dangerous loopy, and helpful delivery loopy. So we're gonna focus on lazy dangerous loopy for now. So lazy dangerous Luffy carries cholesterol from the food. The cholesterol is in the body by this time. So the lazy dangerous Luffy picks it up, takes it to the arteries, and leave it there. Just leave it there. And mind you, lazy dangerous Luffy is lazy. So the he just leaves the cholesterol there. And guess what the arteries are saying? Are you gonna pick them up later? And because he's so lazy, he's like, no, I'm not. And guess what happens? They build up. It builds up and plays a role in forming the plaque. So, yeah. Okay, let's go over that again. So, lazy dangerous Luffy picks up the cholesterol that's in the body, take it to the artery, leaves it there. No matter, it just brings more cholesterol, brings more cholesterol to the arteries, and just leaves it there. It doesn't take it up. It just doesn't care. And over time, that builds up, which is why we don't want too much cholesterol in our bodies, right? And we don't want too much lazy dangerous Luffy either. We don't want that delivery driver in our body. So the next delivery driver is helpful delivery Luffy. Helpful delivery Luffy goes to the arteries, picks up the cholesterol, and takes it to the liver. This is very important. The liver is a very important aspect in the helpful delivery Luffy work, because lazy dangerous Luffy was supposed to drop it off and bring it to the liver, but it didn't. So that's why it builds up, right? But helpful delivery Luffy picks it up from the arteries and takes it to the liver. So we can see here in this artery, it's pretty nice and clear. So if blood was to flow through this, the blood would flow easily in comparison to blood flowing through this. I'm sorry I'm using random colors. Blood can't really get through that one, can it? No, it cannot. Yeah? Okay, we're gonna go over that one more time. So, coronary artery disease, what is it? It's the narrowing of the arteries due to atherosclerotic plaque reducing blood flow to the heart. Remember the image? Plaque causes reduced blood flow. And the plaque is made up of what? Cholesterol, lipids, cholesterol, which comes from food, and it has two drivers: LDL, lazy dangerous Luffy, and helpful delivery Luffy. Lazy dangerous Luffy carries the cholesterol that's already in the body to the artery and leaves it there, causing or playing a role in plaque buildup. But helpful delivery Luffy picks up the cholesterol from the artery, take it to the liver, and the liver does what? Excretes it or remove it from the body. And that's a good thing, because if we don't have the cholesterol, let's make a mental note: no cholesterol, or let's say less cholesterol. Less cholesterol equal less LDL which equal no plaque. So less cholesterol equal less LDL or less deliveries for LDL. Let's say deliveries for LDL, which equal no plaque, right? And no plaque equals no coronary artery disease. So that just goes to show how important of a role the delivery drivers play. Because even though cholesterol is already in the body, it's the delivery driver that leaves it that just leaves it little lazy. Lazy dangerous Luffy is what leaves it in the arteries, causing the plaque. So the delivery drivers plays a big role in where the plaques are there. So now I'm going to talk about the risk factors or the causes, because even though we talked about LDL and HDL, which plays a role in why the plaque is there, which is a major contributor to coronary artery disease. There are many other factors, many other reasons, many other ways it causes plaque buildup in the arteries. One of the first thing that we're going to talk about is hypertension. So hypertension is also known as high blood pressure. What we know about high blood pressure is that the intensity of the blood in the blood vessel is high, basically. It's self-explanatory. So the pressure in the blood vessel is high, which is why it's called high blood pressure. So think of a hose, let's say. So a hose, think of a hose in the sense that if you're constantly just spraying the pressure that comes out of a hose is so heavy. Think of the blood vessel like a hose, okay? So what happens when it's so heavy is that eventually becomes so heavy that the hose itself starts to get weak. Inside the hose start to get weak. And because it's getting weak, it's breaking down. Okay, hopefully that was clear. But let me just use a simple example. So what happens is in high pressure, so high pressure causes breakdown that breakdown in blood vessel causes thin walls in the blood vessel. And thin walls, this is very important. Thin walls mean that LDL sticks easily. Guys, this is very important. Remember, a lazy, dangerous Luffy drops off the cholesterol in the arteries, leaves it there, forms a plaque. And the plaque is what? The plaque does what? The plaque causes coronary artery disease because it narrows the artery. Okay? So yeah, high blood pressure, the pressure causes the walls to thin. The thin walls causes LDLs to stick more easily. I think I have an image. I'm just going to show you guys an image. This image explains it perfectly, guys. So the blood pushes against the artery. So as we can see right here, this is the blood just pushing against the pressure of the blood just on the walls. And then what happens? The walls start breaking up. The walls start breaking up, guys. And because the walls are breaking up, it's so much easier for LDLs to just latch to the wall because the walls are so thin, and that's what caused the plaque to build up. I just kind of oh yeah, I can actually erase this. So as I said, the plaque just latches to the wall and build up. Let's forget the inflammation for now. So the plaque just attaches to the wall and yeah, build up and cause it to narrow. Remember, we're talking about the narrowing. So here it's narrowing, and then what? Reduced blood flow. Because remember, that's what coronary artery disease is. Coronary artery disease is what? Coronary artery disease is the narrowing of coronary arteries due to the plaque reducing blood flow to the heart. And that's what we see with hypertension. The pressure of the walls, the pressure on the blood vessels or the walls causes the lining of the arteries to be damaged or break down, and that cause LDLs to stick more LDLs, plaque. I'm sorry, wrong language. It causes more cholesterol to stick more. I'm sorry, guys. My apologies. It causes cholesterol to stick more. Why? Because of the increase lazy delivery drivers or delivery lazy dangerous Luffy. Sorry. So hypertension, it with eye pressure, it causes the breakdown in blood vessels or the arteries, breakdown in arteries, which thins them or damages them, and that causes cholesterol to stick to them more because of there's an increased lazy dangerous Luffy. Yeah. Okay. And this is the picture. So pressure damages increased cholesterol, forming the plaque because the lazy dangerous Luffy left it there. Okay, yeah. So high pressure, and then in the same sense, smoking as well. It's the same thing. So smoking, um, let's change the ink there. So smoking does the same thing. So smoking damages lining of the vessels or of the arteries. It causes what? Cholesterol to stick more, forming plaque. Why does it cause cholesterol to stick more? Because of increased LDLs. So more delivery drivers, more lazy, dangerous Luffy. So yeah, more lazy, dangerous Luffy. More than one drivers bringing the cholesterol in and just leaving it there, and that causes the plaque. So smoking, hypertension. So now this is where it really comes in. First, for those who are not aware, hyper, high, or excess. Lipids is just lipids, and emia is in the blood. So by definition, we can define what that means. But the real question is, how does it cause coronary artery disease? Remember I was telling you about cholesterol up here? And remember I was also talking about lipids? This is how. Lipids, cholesterol, okay? So if we have high cholesterol in the blood, what does that mean? Plaque formation. It's simple. So high cholesterol equal increased plaque. But it's not, it is simple, but it's not that simple. Why? Why is the cholesterol high in the arteries? Why? Because remember where I said we get cholesterol from the food that we eat and from the blood. So in this case, there is high cholesterol in the blood. So who is going to pick up that cholesterol? Yes, bingo. The person picking up that cholesterol is lazy, dangerous Luffy. And lazy, dangerous Luffy is going to take it where? To the arteries. And what is he going to do? Leave it there. And when he leaves it there, what's going to happen? Increase cholesterol. And increased cholesterol leads to what? Plaque formation. Get it? Okay. So that's basically what hyperlipidemia causes coronary artery disease. Let's go on some more. There's just a few more, guys. So diet, physical activity, or lack of. Let's say lack there. So how does physical activity cause that? Because remember, let's also put obese right here because it goes hand in hand. So if you're not exercising and you're not eating, let's say you're just not exercising. If you're not exercising, what do you have? A lot of stored fat. Fat is also lipids, right? It's a fat. Lipids a form of fat. So you also have lipids, stored fat, right? If you have stored fat, what does that mean? Increase cholesterol. And what does increased cholesterol mean? There was a increase in LDL or presence of LDL. And there increase in LDL, there is less HDL. I'm sorry guys, and don't want to make it confusing, so I'm just gonna go over it again before I continue. So hypertension causes coronary artery disease. Why? Because high blood pressure, right? So high blood pressure causes the walls of the vessels or the arteries to thin. And when it starts thinning, it's damaged, right? So if it's damaged, now cholesterol can stick more easily to it. But how does cholesterol get there? Cholesterol get there because lazy dangerous Luffy brings it there. And he's not picking it up. And there's more, there's like, say there's 500 dangerous Luffy and there's not enough helpful Luffy, so it stays there and it doesn't get removed, and that's what causes the plaque. I just wanted to make sure I'm clear there. No, smoking, it happens the same way. Smoking damages the line of the arteries. Remember what I said? If the line is damaged, what happens? Cholesterol stick more. Why is cholesterol there? Because there's increased delivery driver bringing it there and decreased helpful delivery Luffy picking it up. If helpful Luffy is not picking it up and lazy Luffy is just dropping off, then it's not being picked up, and that's what caused the plaque, because it stays there and it caused the plaque. Now I said hyperlipidemia is also a cause for coronary artery disease, because remember, coronary artery disease happens because of the plaque, right? A main reason is because of the plaque, right? So we know that hyperlipidemia, we know what it means. High lipids in the blood. We know a type of lipid. What type of lipid did we know? Cholesterol. Why is there high cholesterol in the arteries or in the blood? Okay, so LDLs, those are what? The delivery driver of cholesterol. Where do those delivery driver get cholesterol from? The blood. It gets cholesterol from the blood and from the food that we eat. Well, the food that we eat goes into the blood, so it goes hand in hand. But so we have what? We have an increased LDL in the body. Lazy Luffy just keeps dropping it off, and now there's not a lot of helpful Luffy. So what happens? It stays there. When it stays there, increase the cholesterol, and increased cholesterol causes plaque formation, okay? Yes. So now, physical activity, we said that when you're not physically active or you're obese, you have a lot of fat, lipids. The lipids that we know is cholesterol. What do we know about cholesterol? When there's cholesterol, or cholesterol in the arteries, is delivered or moved around by what? Lazy Luffy. And what does if there's more lazy Luffy and there's less helpful Luffy, what's gonna happen? I already put this here, but if there's more lazy Lucy and less helpful, more cholesterol. And more cholesterol means plaque. Because remember, yeah, it's pretty self-explanatory there. And diet is also, it goes hand in hand. If you can explain what the diet means, you're picking up. Pause the video and tell me what you think or how you think diet would contribute to coronary artery disease. Okay, so diet. How? Because diet, high fat. If you're eating a high fat diet, which we don't want, right, guys? We don't want a diet high in fat. Because if we have a diet high in fat, we have what? More cholesterol in the body. Sorry, guys, my handwriting is more cholesterol in the body, right? And more cholesterol in the body means what? More pick up. Who is the pickup person? Lazy Luffy's picking it up. And Lazy Luffy's taking it where? To the arteries. And what? If we have less, and if we have less helpful delivery Luffy, then what's gonna happen? Cholesterol is just gonna skyrocket, right? There's gonna be increased cholesterol, and then what? Plaque. See? Simple right there, right? It can also be caused by lasting diabetes, for the same reason smoking and hypertension causes it, but in a different way. Because in hypertension, it's caused by the pressure. In smoking, the damage from the nicotine. I don't think I said that. Damage of the lining. Why? Because of the nicotine. And then diabetes, because of the sugar, right? So the sugar, our blood glucose, damages lining. If the lining of the arteries are damaged, then what? Cholesterol sticks more. And if cholesterol sticks more, and there is increased lazy delivery, lazy dangerous Luffy, and there's a decrease in helpful Luffy, because it's not a balance, right, guys? Because it's not balanced, it causes increased cholesterol over time, which leads to plaque formation. I think it's pretty simple that it all comes back to plaque formation for everything. So yeah. But guess what, guys? That was just one category. This was just the things you can change, modifiable. So let me just put that. I think I used up pretty much all the colors here. So these are all modifiable. You can change them. Now let's just focus on a few non-modifiable. These are pretty straightforward, so I'm not gonna go over them. So age, gender, and family history. But let's just go over it one more time before we move on. So, coronary artery disease, what is it? It's the narrowing of the coronary arteries due to atherosclerotic plaque reducing blood flow to the heart. So, as we can see, the plaque causes the vessel to narrow. In comparison to image 1, image 2, the blood flow, which is this, is less. Simple, right? And we know the plaque. Why? Because the plaque is the main focus of the coronary arteries or the coronary artery disease. So what causes the plaque to be there? We know it's made up of cholesterol. And where does cholesterol come from? The food which eventually get digested. It's in the blood. So food and blood. We know cholesterol has two drivers, lazy Luffy and helpful Luffy. Lazy Luffy brings the cholesterol to the arteries, leaves it there, doesn't pick it up, forms a plaque because it's there over time, right? That's just the main image when you're looking at lazy Luffy by itself. Then you have helpful Luffy, which picks it up, take it to the liver. What does the liver do? Remove it. And that's pretty much it. So what we want here is a balance. So we want balance between HDL and LDL. Or we want increase HDL and decrease LDL. Remember why we want decrease LDL? Because LDL is lazy. It just leaves it there and it causes the plaque, which is what we don't want, right? Then we went and looked at some risk factors which are modifiable. We talked about high blood pressure and hypertension or hypertension by definition. We said that high pressure causes thin walls or breakdown in the blood vessel. Thin walls cause cholesterol to stick more. Increase, which means there is increased LDL and decreased HDL because lazy Luffy brings it there, leaves it, it sticks or it builds up. And we don't have enough helpful to remove, because if we did have a lot of helpful Luffy, then it wouldn't be sticking because it would be gone, right? And then smoking does the same thing. The nicotine from the smoke damages the lining. We said when it damages, cholesterol sticks more. Why? Because there's an increased LDL because they're dropping it off. Decreased HDL, not picking it up, cause a plaque. Hyperlipidemia, by definition, is just more lipids, cholesterol in the blood. Who brings it? LDL and HDL. If you have more person dropping it off than picking it up, what happens? Build up in cholesterol. Build up in cholesterol forms plaque. Physical activity. So if you're not physically active or you're obese, you store a lot of fat. If you store fat, that means you have more cholesterol in your body. More cholesterol means you also have increased LDLs. And if you have increased LDLs, you have decreased HDLs. Or LDLs, you have increased lazy Luffy and less helpful Luffy. And that means you get more cholesterol, which causes a plaque, right? And diet. High fat. You're literally putting the cholesterol in your body. Remember what I said, if you have more cholesterol, you have more lazy drivers. They need to drop it off. So more lazy drivers mean less helpful drivers, because all the drivers are converting to being lazy. And that increases cholesterol, that causes the plaque. Diabetes, the sugar damages the lining, cholesterol sticks more. Why? Because if you have more cholesterol and damaged wall, lazy Luffy is there more because it needs to pick it up. And helpful Luffy is not there because it's not. Sorry, lazy Luffy is picking it up from the body, dropping it off. But sorry guys, I don't want to confuse you. So When I'm saying picking it up, I mean taking it from the body and dropping it off. But helpful if it picks it up from the arteries, bring it, drop it off, and deliver. So the drop off spot is different, and we also need to pay attention to that. But yeah, so increased cholesterol, plaque formation. And then the non-modifiable risk, which is risk we cannot change. We can't change our age, we can't change gender, we can't change family history. So that's pretty much a lot for that. But we're just gonna go over. Oh, I'm sorry, guys. Okay, yeah. So before we go over the types, or before we go over the types and close, what we're gonna go over is the complications. What do we notice when we have coronary artery disease, reduced blood flow? We already know why there's reduced blood flow, because the narrowing from the plaque causes less blood to flow through the vessels. Reduced blood flow. That's pretty straightforward, guys. We know what happens. Yeah. And then angina is also a complication. But this also goes hand in hand. What is angina, guys? Angina is just chest pain. Angina is just simply chest pain. Why does that chest pain happen? I'm going to show you an image. No, it's not there, is it? Chest pain, right? So, what does that mean? Why do we have chest pain, or why does angina happen? This is very important to understand. Chest pain or angina happens because of reduced blood flow to the heart. Sorry, guys, my pen is acting weird. That's why. This is why angina happen. Reduced blood flow to the heart. Angina happens because of reduced blood flow to the heart. Okay? So reduced blood flow to the heart. And remember what happens in coronary artery disease. Reduced blood flow. Why? Because the narrowing of the arteries from the plaque causes reduced blood flow to the heart. If there's reduced blood flow, then what's going to happen? Chest pain, angina. And simply like that. Not much to say there. And it can also cause myocardial infarction. What is myocardial infarction? Guys, you should know this, please. Heart attack. Why does that happen? This happens. Heart attack happens from what? Heart attack happens because of blood clot. But how does blood clot play a role, you may ask? This. I'm going to show you an image. Okay, let's take a look at this. Remember we said this is the artery, right? The plaque buildup, this is all cholesterol. And that caused the plaque. Forgive my spelling, guys. I'm sorry. Cholesterol. So, yeah, etc. There are other things in there, guys, but we're just focusing on cholesterol. So, this is what happens. When this bursts, it bleeds. Why? Because this is still a tissue or muscle. This is still something. So it bleeds. When it bleeds, blood leaves. Why do you sound like when it bleeds, blood leaves? But yeah, so this is the blood. And what happens when that blood moves around? It blocks the way. It pretty much blocks the way. Let's take a look at this. So see, the plaque is broken. It bleeds. And when it bleeds, it blocks the entire pathway. Nothing can go anywhere else. Right? And because it's blocking that pathway, what's gonna happen? See? This part is starting to die. The tissue starts to die because it's not being. Guys, you also have to understand coronary artery disease. Remember, I told you that the arteries are in the heart, they're in the heart, and these feed the heart. So, if the heart is not being fed, what's gonna happen? It's gonna die. Reduce blood flow. That's why you have chest pain, as I said, and that's why you'd have a heart attack. So when it causes a blood clot, so let's see, blood clot blocks artery completely, and that cause reduced blood flow to the heart, and then you get a heart attack. Sorry guys, so reduced blood flow, heart dies because the heart is not being fed. Heart dies, and then you get a heart attack. As I said, angina, reduced blood flow, myocardial infarction, reduced blood flow. But the difference with both of these is this. Because if we look at the picture right here, we see that in this, the plaque is blocking or narrowing the pathway, which means less blood is going through. But that means there's still blood going through. Versus this one where there is nothing can pass here. There's no blood on this side, none. And this is what heart attack is. And versus this is what angina is. Mind you guys, angina happens when you're doing activity. Why? Because when you're doing activity, your heart needs to work more. And if your heart's not working more and there's less blood flow going to the heart, going to your tissues, then you're gonna go into your heart muscle rather, then you're gonna feel chest pain. Yeah, pretty much. That's pretty much what that is. So we know narrowing, let's go over it. Narrowing and plaque cause reduced blood flow. We know reduced blood flow causes angina because when you're working out or doing activity, let me put a note right here so that you guys don't misinterpret that. So activity equals more demand with less supply, which end result that's pretty much it. So yeah. And then you can also get arrhythmias because we know with reduced blood flow, now your heart feels like it's dying when you have reduced blood flow. Let me put this first. So with reduced blood flow, your heart may feel like it needs to work fast, a beat too fast. Or it's like, okay, I need to conserve my energy so it beats too slow. And that's what happens. Arrhythmias is just irregular heartbeat. Yeah. And you can also have heart failure. So heart failure happens from, by definition, heart failure. So that means the heart fail. In comparison to heart attack, the heart dies because it's not getting reduced blood flow. But heart failure is that it's working so much. So it's working so much. Let me just put reduced blood flow because that's the premise of everything. Means what? More work from the heart. More work from the heart means what? It gets weakened over time, weakened muscle over time. And weakened muscle means what? Heart failure. So the heart just fails. And last but not least for this one, it can cause sudden cardiac death. And this comes from the heart attack, the heart failure. So heart attack or myocardial infarction, heart attack, heart failure. So all of these causes cardiac death, to be honest. This can happen and result in cardiac death. Yeah. So I'm just gonna go over this aspect one more time so we can get it. So the complications, as we already know, we know that the premise of coronary artery disease is that there's reduced blood flow. Why there's reduced blood flow? Because the plaque narrows the artery and less blood comes through it, right? So we know from the reduced blood flow you can get chest pain. Why? Because if you're doing exercise or any activity, your heart needs more blood, and because it doesn't have more blood to get, there's less supply of blood, you get less oxygen, less blood flow to the heart, and that's what causes chest pain. And then myocardial infarction, which is heart attack, that also causes coronary. That also occurs as a result of coronary artery disease because it can cause a blood clot. Remember, there's a plaque, and the plaque, when it breaks, it bleeds. That clot from the plaque, when it bleeds, it clots, right? We know when blood bleeds. Blood bleeds what? When there is blood, it clots. And that clot can cause blockage to the entire artery. So that means no, you see, in comparison to here, you have some blood flowing through, but here nothing. So because there's nothing, the heart is not getting any blood, and so it dies because it's not being nourished. It dies, and that's what a heart attack is. And arrhythmias, irregular heartbeat. Remember, reduced blood flow is the premise. So the heart's not getting enough blood. So it might, okay, let me beat faster so I can push more blood through. Or let me beat slower so I can save some of the blood. So there is that irregular rhythm. So it's not going as its regular, lubbed up. So that's pretty much what arrhythmias mean. Heart failure. We know that heart failure comes from reduced blood flow because remember, that's the premise. Reduced blood flow means the heart want to work more, and because the heart want to work more, the muscles weaken over time, and weakened muscles lead to heart failure. And we know sudden or cardiac death happens as a result of heart failure or heart attack. Now, I'm sorry guys, this part of the video was deleted, so I recapped in the end of the video, so you can watch that and come back to the next part, and I'm going to continue on, but my apologies. So the first thing that you need to do is lifestyle change. First thing, lifestyle change. And what are the lifestyle changes you can make? Modifiable risk factors. So you're going to change the modifiable risk factors. Just look at them. Go back and look at them. And you can see, so smoking, quit smoking, exercise, eat healthy meals with less fat. Remember, fat causes cholesterol, right? Bad cholesterol, which is lazy Lucy. So then the second thing that we're gonna do, if that doesn't work, is medication. What kind of medication? Nitrates. Nitrates, the first one. What does nitrates do? Remember what goal we're working towards? Reducing blood flow. So nitrates relaxes blood vessels. Then we need some statins for the cholesterol. So remember we said cholesterol plays a major role in the plaque formation. So lower cholesterol to slow plaque buildup. We also need antiplatelets. Why antiplatelets? Because blood clots. What does blood clots play a role in? Heart attack. Why? Because it blocks the entire artery. So what? We want to reduce blood clot. And we don't want a heart attack, right? And then you also have beta blockers, which slow the heart. So it uses less oxygen. Just think of it like this when I say slow the heart. Because remember, if the heart's beating faster, it's going to run out of breath easier. Let's use like those terminology. Run out of breath easier. If it runs out of breath easier, then it's going to die faster because we know it has no energy. So we want to slow how much oxygen it's using. Then calcium channel blockers. Relax and widen blood vessels, and it lowers blood pressure. And we know all blood pressure causes coronary artery disease. So well guys, that's pretty much it for today. Now I'm just gonna go over everything. So I did say coronary artery disease is a narrowing of the coronary arteries due to atherosclerotic plaque reducing blood flow to the heart. We know that the plaque causes reduced blood flow, as we can see here. Reduced blood flow because it narrows the artery. Now we know it's made up of cholesterol, which is a main contributor to the plaque formation, which in and causes it to be a main contributor to coronary artery disease. We know the cholesterol comes from the food and it's in the blood. We know that we have two delivery drivers, lazy Luffy and helpful Luffy. We know lazy Luffy just drops it off, picks it up from the body, drops it off in the arteries, and just leaves it there. And when you have more drivers dropping it off and you have less driver picking it up, we need it stays there and forms a plaque, which is why we need a balance. We need a balance between healthy Luffy or helpful Luffy and lazy Luffy, or more helpful and less lazy, because now it gets moved out, right? It's not just staying in the artery. And then helpful Luffy picks it up and takes it where? To the liver. This is very important. Takes it to the liver and the liver drops it off. This is very, very important. Very, very important, guys. Very, very important. So we're gonna coin HDL, the good cholesterol, and LDL, bad cholesterol. So we want the good cholesterol. More of the good cholesterol, less of the bad cholesterol. Yeah. And the risk factors, we know hypertension, high blood pressure damages the wall, damage wall, mean more cholesterol state, more cholesterol means more bad cholesterol, less good cholesterol, because cholesterol stick because there is more bad, less good. So there's not a balance, which is what we said that we wanted, right? A balance. And that image just goes over it. Then smoking, we know it does the same thing, damages the line. Cholesterol sticks more. Why there is more cholesterol to stick? Because lazy Luffy just keeps dropping it off, and there's not enough helpful Luffy to remove it in time, so the plaque forms. Now, hyperlipidemia, by definition, we know it's high cholesterol in the blood, and high cholesterol means that there is more of the bad Luffy or the lazy Luffy, and less of the helpful one. So that causes increased cholesterol in the arteries, and that causes plaque formation. And in physical activity, come back to fat, more cholesterol, more bad, call it more lazy Luffy, less helpful Luffy, cholesterol build up, plaque forms. Diet high fat, we want to have avoid high fat because high fat means high cholesterol. If you have more bad cholesterol and less good cholesterol or less helpful cholesterol, then cholesterol builds up in the arteries, plaque formation, diabetes, same way as hypertension and the other one, hypertension and smoking. More sugar damages the lining, cholesterol stick because there's an increase in lazy Luffy, decrease in healthy Luffy, cholesterol build up, plaque forms, right? Non-modifiable, age, gender, family history. So pretty straightforward for those. We didn't go over the types in this video, so next video I'll probably do it. Complication, reduced blood flow, because remember the narrowing and the plaque causes less blood to go through. Less blood going through causes angina. Angina is chest pain. Why? Because there's reduced blood flow. But why is there reduced blood flow? Because when you're physically active or doing something, your heart pumps more blood. Because remember, even if you're running, you need more energy, you need more blood to be moving around your body. And because there's not enough blood, because there's reduced blood flow, less oxygen is going to the heart. And if less oxygen is going to the heart, you get chest pain. Myocardial infarction or heart attack happens because of a blood clot. As we said up here, the plaque burst causes a blood clot. When blood clots, it blocks entire vessels. If the entire vessel is blocked, the tissue die, and that can cause heart attack. Arrhythmia, we know irregular heartbeat because the body now needs to compensate, so it may beat too fast or beat too slow, and that's where you get the irregular heartbeat from. Heart failure, now the heart is working 2 times as hard to try to get oxygen, and so because it's working so hard, we can muscle over time, and then the heart fails. Pretty much how that happens. And sudden cardiac death, which is very important. Heart attack, heart failure can cause your heart to basically die, because some heart attack you can recover from, but you can just die because of an heart attack. So, and how do you imagine coronary artery disease goal is to reduce blood flow and so wait, sorry, I was going too fast. So the goal is to increase blood flow because there is reduced blood flow. Because remember, that's the premise of coronary artery disease, reduced blood flow. And we also want to decrease the demand for oxygen. So we don't want the heart to work too hard to get oxygen. So how do we fix that? Lifestyle changes. How? What kind of lifestyle changes? Look at the modifiable risk factors. Those change. Stop smoking. Diabetes, fix that. Hypertension, fix that. Physical activity, increase that. So those are the lifestyle changes that you need to make. Then medication. Nitrates, relax blood vessel, so more blood can flow, which is what we want, right? Statins. Remember that term because it's going to be very, very important, even in clinical. Statins lower cholesterol to slow plaque buildup, antiplatelets, and then you have beta blockers and calcium channel blockers. Yes, that's pretty much it for today, guys. Thank you very much. Subscribe to the channel because I'm going to be bringing more videos, try to explain it. And if you don't understand anything, just let me know. Thank you. Bye.